Thank you so much for sticking around. It's our public affairs show. My name is Lena Girl, and we are talking story with our gang from Shriners Hospitals for Children, Honolulu. Very big mahalo to Chief Nurse Officer Andy Kubota. She's going to hang out with us in this particular segment as we talk story with Dr. Graham Fedorak, who is here. And you are a medical expert in what particular field?
I'm a pediatric orthopedic surgeon.
And what does that entail?
So typically orthopedic surgeons train for 5 years after medical school to become a generalist. So you gain a little bit of knowledge about sports medicine, fracture care, a little bit of everything. But then most of us pursue subspecialty training in what interests us most. And for me, that was taking care of kids and specifically pediatric disorders.
That's fantastic. You decided, you could have worked, with that background, you could have worked with the NFL. Right?
Sure.
You could have worked with, the NBA, all of these, millionaire superstars, but you chose to spend your time here in Hawaii with children.
Well,
Why?
you're sort of making me question my choice now. No! Working for the NBA, that would be great. Hey. I'm a huge basketball fan. But why did I choose Hawaii? This was essentially my dream job, no joke. I'm fresh out of training. I've only been working at Shriners for 7 months. And prior to that, I was doing my pediatric fellowship at the Shriners Hospital in Los Angeles. And before that in Canada. And I was scheduled to go on to do more training in spine surgery in Vancouver. And this job popped up, the job at Shriners Honolulu, which for the last 4 or 5 years, I had always had on my radar. My wife and I have always dreamed about living in Hawaii. We got married here years ago on Maui.
Awesome.
And I'd always wanted to work for Shriners because of the ethic of the whole organization.
Awesome. Well, welcome to the Ohana. Are you a dad? Do you have children?
Yes, I am. I have 2 little girls,
awesome.
Katrina and Ariana, and they're 6 and 3.
And, when you are able to work with the children here and knowing that you're a dad and you have your own children, what is that like emotionally? And I know sometimes as a doctor, you have to separate yourself. I get that. But is there ever a moment where sometimes there's that connection with a child that you are helping?
Sure. I think the biggest thing for everyone in pediatric orthopedics is that we love kids. I think the most challenging thing sometimes as someone that loves kids is when you see families with tremendous challenges and children
Absolutely.
with tremendous challenges, and you just want to do everything that you can to try to help them. And I think at Shriners, the best part about the job is that I don't have to worry about the business of medicine. I can just do whatever I can and know that the organization is going to support me. We have 3 pediatric orthopedic surgeons who are full-time right now and potentially bringing on a 4th. We have a number of orthopedic surgeons who help out for periods of time, be it a month, be it a couple of weeks. As Andy was mentioning, we go on outreach missions a lot to the South Pacific. And so we have other people that step in to keep us busy when 1 or 2 of us are away.
Now, are you also part of that fracture clinic that Andy had mentioned earlier in the show?
Sure. All the surgeons work in the fracture clinic, and we're typically responsible for covering it 1 to 2 days a week. I think that's one thing that differentiates our clinic from a lot of the other clinics which may be available around Hawaii is that it's staffed by pediatric orthopedic surgeons. And so you're
going to get the best care.
Not to speak badly of any other facility which may be out there, but you get a surgeon's opinion on your injury, be it a sports injury or a fracture or something as benign as a sprain.
Normally you have to go through a lot of other people. First you see a triage person, and then the triage person takes you to a nurse, and then maybe a nurse practitioner will step in, and before you actually get to see a doctor who will probably spend maybe about 2 minutes with you assessing you on a chart,
Right. Well, we're salaried, so we get to spend a little bit more than 2 minutes, which I think that's a wonderful thing about working for Shriners is that we can take time to get to know our families better. But you're right. There are less intermediary steps. You get a diagnosis quicker and hopefully get your treatment a little bit quicker as well.
What are some of the challenges that you see with our families? Is there anything, because I'm thinking to myself that there are families out there that have their kids maybe playing sports. Is there anything that they can do to be safe? Of course, you're going to see them after injury, but is there anything that they can do preventive-wise, and then coming from a surgeon, coming from a doctor, that they can do to keep their keiki safe when they're participating in physical activities?
Well, I think that physical activity is tremendously important, and the more active children are, the likely better chance you have of preventing injury. One thing that has come up in the literature a lot recently is preventative training for ACL injuries for girls. As female involvement in sports has increased over the last 10, 20 years, we've seen an epidemic of ACL tears in young girls, particularly teenagers. And so a lot of programs, soccer teams, basketball teams now do a specific preventative training program to try to decrease the number of injuries. I've seen that in a number of other places I've been. I don't know whether it's happening here in Hawaii, but it can really decrease the number of ACL tears in young women.
And family, you folks are listening in, you are getting top-notch advice right here to get your children into these possible clinics or, ways that they, sessions in which they can, keep healthy. And I think that's the whole idea. Not that we don't want you working. We don't want you out of a job. But the whole idea is we want to prevent injury, right?
Absolutely. There's more than enough work to go around.
Absolutely.
And the most important thing is just taking care of people and trying to decrease the number of injuries that they have. That's one difference between pediatric orthopedics, I think, and a lot of other branches of orthopedics is that a lot of the care that we provide is non-operative, in that the fracture, which would require a surgery in an older patient, might be very well treated with just a cast or a removable splint. And so I think that that's one of the big differences between what we do and what a lot of the adult surgeons do. Kids heal. Kids are great. Kids do really, really well. And it's important to understand that when you're taking care of them.
So can you kind of walk me through a child walks in, it's your day at the fracture clinic. A child walks in with a broken bone. Can you kind of walk me through the steps of what you do and how long you stay with them through their care?
Well, it really depends on what's brought them in. If they've walked in, that means it's probably not a femur fracture or anything like that. What we typically see a lot of ankle sprains or ankle fractures, wrist fractures, forearm fractures. So those kids come in, they've typically gone someplace else for care beforehand to an urgent care clinic and then been referred along to us. And so I think what we would love is if those children were just to come directly to us and take out that intermediary step, save them the time. It's a lot of hassle.
Well, I think that I'm so glad that you folks are here with us. Shriners Hospitals for Children, Honolulu, because I think a lot of families don't know that.
Absolutely.
I think a lot of them automatically assume, okay, I just got to go to the nearest hospital, whether or not mom has insurance and dad has insurance or not. I just got to try and or a lot of times they won't go in anywhere because they don't have that insurance coverage. They're going to try and do at-home remedies. They're going to go online. They're going to try and pull up a website and it'll have some cockamamie way of soaking your foot and stuff like that. When in fact, as a child, any child 18 and younger could walk right into, the doors of Shriners Hospital and be helped.
Correct.
I don't think they know that.
No, and I'm new to Hawaii, having only been here for 7 months, but my understanding is that the perception is that Shriners only takes care of people without insurance or children from the South Pacific. And that's something that's changed a lot in the last couple of years.
I love that.
We have expertise. We are happy to share it. We're happy to take care of anybody that needs care that's under 18. And I'd encourage people to come and take advantage of our knowledge. It's a wonderful hospital for anyone who's never been there. It's a beautiful, beautiful space. And I think our team does a great job. And everybody's really friendly. So as people become more aware of what we do and that we are an option, I think that we'll see more and more people from Hawaii to supplement the kids that we see from the South Pacific, which is it's an awesome part of the job as well.
Well, I want to thank you so much for being so passionate about the work and passionate about our keiki and getting the word out that we help our children here in Hawaii. It's not just the ones that we find out. In my head, honestly, I've always had an idea that Shriners only helped severe cases, children with cerebral palsy, with, and the musculature and stuff like that. I mean, I didn't know that a child with a sprained ankle or a child with, maybe a hurt arm could walk in to Shriners Hospital and get the help that they needed. And it's beautiful that you're getting that word out. Thanks. Thank you so much for joining us, Dr. Graham Fedorak and Andy Kubota, who said absolutely nothing. He's passionate about the work.
He is. No, he did awesome job.
Yes, absolutely. And please remember that number, 941-4466, shrinershonolulu.org. We're going to talk more story with our family and friends of Shriners Hospitals for Children Honolulu when we return.